G'day John, so I'm recording this video for you in relation to the video you sent me recently on your problems with shoulder abduction. Apologies for some sniffs and sniffles and possibly a cough every now and again. Part of the reason why I've been struggling to get this video out is because I've been a bit under the weather, and so talking about this stuff is hard when you're constantly coughing or sniffing, but hopefully we'll get a good run. This is like my 15th take on trying to get this video out, so I'm just going to push through on this version. So what we're looking at is your problems with shoulder abduction, which is this movement here, right? And you're having problem both producing the strength and getting past that 90-degree angle in terms of the abduction. Well, the first thing we need to look at is we need to look at why it's occurring, and I'll give you an indication of what it is. And I determined this from not just our past conversations, but a lot of it from the video that you sent through. So thank you for sending that video through. So I've got here Fred No Head, no, lost his screw that holds his skull in, so that's all right, but we don't need it. So what we're looking at is we're looking at the glenoid humeral joint, which is the head of the humerus, the ball right here. This is your collarbone, and this is your scapular and acromion process. So ideally what we're looking for when we're moving the shoulder around is we want the ball of the head of the humerus in the shallow socket. But we don't just want it in the shallow socket, we want it in the center of the shallow socket. Because if that ball is positioned forward, and this is not just in static posture, this is dynamic movement. If it's positioned forward, what you get this pinching, right? Which is impingement. Basically all the soft structures in this portion here constantly get pinched, and after a while of getting pinched they get inflamed. When they get inflamed they swell, and it limits the movement. Also your body shuts it down because it recognizes that you can't do this movement effectively, so it's like, well, stuff you, I'm just not going to do it anymore, right? So that's part of it. The other, when we're looking at it, however, in a optimal point of view, you're actually able to move that shoulder around and you're able to maintain the space in it. Now, depending on how often you actually move past 90 degrees, this position here, even if you've got good shoulder function, right, that is called the impingement position. So anytime you go past 90, it becomes very difficult to maintain that space. So when we give stuff like overhead presses and overhead work, very rarely, even lat pull-downs, very rarely will we go from this position. We'll go from the forward position, which has a similar training effect, but it tends to be both more functional for most people. It tends to be more productive in terms of strength gains that translate across, and it tends to be less damaging. So that's one area of it. The other area of it is this, and Fred can't really show you to this because he literally has a hole up his ass, right? But what happens is this area of your body, the thoracic spine, needs to be mobile. And what happens is it allows you to extend through the spine, it allows you to rotate, and importantly for shoulder movement, it allows you to move across, right? So ever so slightly, when you're doing things like push-ups and presses and pulls, you can get some lateral movement in the thoracic area that helps create a little bit of space in this joint, all right? So those are two things that happen. Now, what I'm noticing with your posture and your movement, and even though the demonstrations of the exercises you did, you know, they were just for the purposes of video, they weren't like proper technique or anything, they did give an indication of where your shoulder position, where your body position, and where your dysfunctions lie when you're doing these movements. At the very start of the video, you gripped your forearm and it gave an indication that you were feeling a bit of pain through your forearm as well, okay? So this is also an indication of a dysfunction here, which leads to a dysfunction here, or sorry, a dysfunction here, which leads to problems here and problems here. The reason why you're getting more forearm pain, the reason why you're getting more pain through the bicep tendon into the shoulder, and as a result, limiting on the shoulder abduction, is because of dysfunctions here. This pain here is a symptom that this is working far too hard to try to compensate for the dysfunctions higher up the chain or closer to the core. So, to go through some of the exercises you did, when we're talking about pull downs, right, even though you may be going from a forward position, if your shoulder position is forward and you're pulling down from here, as you go through the movement, you're going to get too much contribution from the forearm, too much roll forward roll of the shoulder, and too much contribution from the upper traps. All elevates and locks down the shoulder injury, shoulder pain. As you do your single arm cable press, restriction through the thoracic area means that even though you've got a nice opposite stance, when you go to press, you hit this point where you really should be rotating through the core, rotating through the spine, but you hit this pinching point. So you'll get that extra movement from, again, rolling the shoulder forward, squishing up the shoulder structures, and creating issues for you down the track. Straight arm pull down, all right? The straight arm pull down is a controlled exercise meant to engage the lats. Again, forward position, upward position, compromises your shoulder integrity. Squat and overhead press. Now the squat and overhead press is an interesting one because what you're actually incorporating in that, even though you're using momentum, is you're incorporating this movement here. And this movement here, you'll notice that when you go up to this position, that is the impingement position, right? So that is, when I describe this moving past 90 degrees, this is the impingement position in that area. So that could be a culprit as well. Bicep curls, if we're doing just supinated bicep curls, fingernails up, when we do that curl, we'll actually hunch the shoulders forward, get too much contribution from the forearms, too much contributions from the long head of the biceps, pulls the shoulders forward, traps, pecs, all that stuff I mentioned before, closes off that joint, bada bing, bada boom, injury. Okay, so these are all the things that we have. The leg press, that was also in that video, I'm also going to address, and sort of in this video, because I need you to be mindful of what we actually need for you to be able to ski effectively is a good dispersion of load across the whole structure, not just strong quads. But let me get back on point. So this is all why it happens. Stiff through the thoracic, improper function through the shoulder, through the scapula, clavicle and glenohumeral joint, right? Washes on down the forearm, and this is where we have problems. Now, even though this is pretty shit not to be able to do this, it is good that it's giving you a fair warning shot across the bow that you need to address this. You need to address this both in how you approach your training, so what you integrate into your training. And I know you got a long training history, but you got to understand, like this point of your life you've never been at before. This point in terms of dysfunction, you've never accumulated this much before. This point of injury risk, you've never been at this point before. Everything has changed. And even though you've got a very amazing training history and athletic history, we need to shift the paradigm, and we need to create a new set of rules for you that will work for you right here, right now, to keep you active and strong moving forward. And that constantly needs to be reassessed and readjusted. So I need you to kind of wrap your head around that a little bit, because often we fall into this trap of doing what we've always done. And I tell you now, sometimes doing what we've always done is why we got the injuries and the dysfunction in the first place. And sometimes it just makes matters worse. So that's the win, you recognize it. How do we address it? Well, we start to address it by sneaking some stuff in to be able to alleviate the current inflammation, restore some movement, and allow you to start doing movements more effectively. Big topic, but I'm going to try and give you some stuff here and now to help you address it. So the first thing we need to do is we need to identify that there's going to be some points of overactivation in that area. These are muscles that are working too hard because you're not effectively dispersing the load across the whole structure. So that means you've got issues with your pec minor. All right, so how we do that is we find the pec minor, which is underneath the collarbone. You'll find a dip there. All right, and you're going to press into that. You can also use a broomstick into that, and we can also address it with stretching. So what we're going to do is we're going to do some tissue work around the pec minor, but importantly, we're also going to do tissue work around the whole pec. The reason being is that people often center in on the pec minor because it's tight and reactive, and it's very true. It can contribute to that shoulder dysfunction because it pulls down the shoulder and stabilizes it. But the pec major also, when it's overactive, it will close off this whole joint, and it comes across to the front aspect of your humerus, which means that it pulls it all super tight. All right. So when you're doing this release, you can do it with your fingers, you can do it with a knuckle, you can do it with a broomstick and kind of lean into the broomstick. But your goal is to get underneath the bone, so up underneath, give me a Fred, up underneath the bone here, right, at a 45-degree angle, because you'll find that's really quite reactive there. And then in between the ribs on the sternum, underneath the sternum, so just underneath the meat of your pec, and up to the side. And when you work the side, you're basically working that t-shirt line, right, where the seam of your t-shirt would normally be. So releasing through there, releasing through the upper trap. On the top of the upper trap, just above the bone here, you're going to be working through this aspect. All right, so you're going to kind of pick up the muscle and you're going to work through it like this. All right, nice deep pressure. All of this should be not really uncomfortable, but should feel like there's a bit of pressure there, and you should feel a little bit uncomfortable for this. All right, so we're releasing here, releasing there. You're also going to release on the front of the arm, and you're going to work down the bicep tendon, and you'll know down the long head of the bicep. Sorry, bicep tendon is here, long head of the biceps. So you're going to work down the front of that bicep tendon. So all of that is a release that you can do. How often should you do it? As often as you can. Do it consistently, because what you're looking at is you've accumulated this over days, months, years of repeated movement. This way, you know, one massage will help, but you need to effectively apply it yourself on demand and before you start to feel the pain as part of your proactive approach, so that you're not waiting for the symptoms to happen and your shoulder to lock up before you address it again. So we're going to do all of this stuff here on the front. On the back, and again, I'm going to show you with your fingers, because you can do it with your fingers, but you can also do this foam rollers and balls and whatever. But we're going to get underneath the back of the armpit, and you're going to pull that through, right? The lats can also restrict your shoulder movement. Think of it as an anchor. Helps lock down the shoulder, all right? Can't move the shoulder up because your body wants to protect it. So getting in under the lats as well. All of those are releases that you can do. Now you can do them before your workouts, you can do them as a daily thing, and you can do them in between sets. We're going to get to the exercise technique in a minute, but you can do them in between sets. So basically, as you're doing, let's say you're doing a 1 to 10 rep set, often what happens is our focus starts off really fresh in the first set particularly. We're really mindful of things, of how things move, but by the 10th set, as we tend to get tired, all of that kind of drops down. So we want to make sure that we kind of, each set we reset, and so we're able to get the best effective movement, not the full range of movement, because often the full range of movement is dysfunctional, but the best effective movement out of each set. And that's how we get better results. So all of this stuff is release that you can do. 20 to 30 seconds a spot. You know, you want to have a good firm pressure, not too deep, not too light, Goldilocks, right? The other thing that you can do and I would do this on a more gentle basis, is to do stretches. So some of the stretches I want you to do is a gentle pec stretch. So imagine if I was up against a door frame, right? Yeah, I was up against the door frame. So the door frame was here, turning through, opening up through the chest area. We're going to do that with shoulder at just below elbow, just below shoulder height for you, elbow just below shoulder height for you. And we're also going to do this with our fingers up against the door frame. All right? And Lynn can help you with this as well. The other thing we're going to do is we're going to do a lat stretch, which is hand over, grab the door frame, step back, and curving through the spine to get that stretch through there. So those are some of the things that you can do and start to incorporate into your routine to be able to do it, to be able to do it effectively and reduce the pain. Now, as you are progressing through, it's important to notice what your discomfort levels are at each day and to work with that. So depending on how much time you spend at the office, depending on your stress levels, personal and work, depending on, whether it's cold or not and you're hunching up in your shoulders, it may depend on how much you can do on each given day. But you do need to work within, what your body's trying to tell you. Because if you try to push past that and you just try to grind through it, train through the pain, then often what will happen is you get more inflammation, you get more swelling, and the problem continues on. So, exercises. How do we start to address these exercises? Well, look, there are exercises that need to be prescribed to you to be able to get more out of the exercises that you showed in the video, or showed in the video. So I'm going to kind of break these down a little bit and give you a bit of insight into them, and then we'll kind of continue the conversation. So for the lat pull-downs, one of the important things that you need to be able to do is you need to be able to improve your thoracic extension. Now this is release through the spine, all right? This is also stretching. The lat stretch that I showed you will help increase that mobility through that area, but also it's a scapular depression. So your ability to get your shoulder blades down, right, down, in order to create that pull is important. If you're pulling from an elevated position, you're putting your shoulder in a compromised position, at risk of more injury, and it's just not going to work for you long term. That's a simple fact. So one of the things when you're looking at scapular depression on the lat pull down is starting with a supinated grip, so that's fingernails up and towards you, elbows forward, and you're going to actually start the first pull from your shoulder blades, right? So you're going to pull from the shoulders. Once you're pulling down from the shoulders, as you pull back, you're wanting to maintain a nice angle here, not closing up the gap, a nice angle here, almost 90 degrees. And as you pull down, that shoulder is traveling back as well. So it's opening up through the chest. Otherwise, if you don't do this, you'll kind of be doing this movement, and you may even get a curl of the spine over. So this is what we want, scapular pull, coming down and through there. Be mindful that you don't want to be pushing through the chest, so you don't want to be elevating through the chest too much, so your ribs are pushing out to the front. You also don't want to be collapsing down too much, because then your shoulder will be rolling forward. In terms of the other exercise to be working on is a retraction of the shoulder blade. So these incorporate exercises that you may not have in your program. We're talking about like a rear delt raise, where you're coming up with a straight arm and targeting the back of that shoulder. Rear delt flies with the cables and the bands, lightweight, high reps, working with, or relatively high reps, working within your current range. These may be a bit shaky at first because you're not used to working them. Those will all build your ability to put your shoulder into a good position and retract it effectively. Do note that I'm going to talk about scapular protraction a little bit later in one of the following exercises, because that's something you need to be mindful to kind of stick that scapula onto your rib cage and get good movement from it there, stable movement. So what else we got? So we've got single arm press. So you were doing a single arm press as well, similar to the pull up. You want to be able to keep the elbows front, fingers, hands in a neutral position. Don't close up the shoulder. You actually want it more open, right? So neutral is a good compromise, and pushing it overhead. Be mindful of tilting through the body in order to compensate for that lack of thoracic mobility. This is a big part of it. Like, this is the cause that we really need to free up in order for you to move your shoulder health along, and in fact to move your leg strength along as well for skiing. External rotation. So I like that you got the external rotation band movement in here. but take note of if you're doing it this way, right, shoulder forward, you're going to create that impingement position, too much contribution from the upper traps, not enough contribution from the muscles that you actually should be targeting. And if you're doing it fast and explosively, you're kind of just blurring your way through the movement and you're not getting most of the benefit from it anyway. So just be mindful of that external rotation. Straight arm pull down, again, similar to the similar to the overhead pull down. We're looking for shoulders in a good position. Squeezing through at the bottom position, you should be checking your lats, making sure they're active and they're actually pulling your shoulders back and down, and you're actually getting that movement. Do be mindful of extension, so bending and extending through the elbows, because you'll turn that into a long head tricep movement. You really want to keep it at a weight where you're able to maintain that pull effectively. And again, be mindful of your shoulder position, your scapular position before the movement, at the start of the movement, and at the end of the movement. Squat overhead press, switch it from here to here, right? So when you're pulling, right, if you're working with kettlebells, it's nice because you can get that position here, boom, and then you can press directly up. Don't be pressing anything from this position, so don't be raising it from this position, and don't be pressing it from this position, because you're setting yourself up for more impingement, more inflammation, and more swelling and less movement, more injuries. So those are some things for your shoulders. Hopefully that makes sense and you can incorporate that into your training. So remember, modify the exercises, be diligent on the technique, but remember the technique is underpinned by function. So if you don't do the corrective work, if you don't do the tissue releases, if you don't do the accessory work, if you don't adjust the technique, all of this kind of loses its efficacy and you end up, not progressing as quickly as you like. Now, what does all this have to do with your leg press hold? Well, when you went to demonstrate the leg press hold, it showed how stiff you were through the posterior chain. Now, when you're stiff through the back, right, this posterior chain, what you tend to get is an over contribution from the quads, which are the big muscles at the front of your legs, under contribution from your glutes, both on the back of the legs, the stabilizers. You also get over contribution from the hip flexors and the calves. Now, anything that happens on the bottom half will affect the function of the top half. To give you an example of this is that if you are really stiff through the thoracic spine, you tend to be more mobile through the lumbar spine, but in response to that, your brain tells your body to tighten up all the structures of that lower area, around your abdominals and lower pelvis and into your legs. So you end up with this like compressing effect and it stiffens up your body even more. All right, so it creates like a tug of war effect in your body. How does this affect you for your leg press holds? Well, with your leg press holds or a squat hold, what you're looking for is even distribution of load between your pelvis, your knees, your ankles, and if you're on your toes and you're going for an athletic movement like a lunge, even your big toe. But what's tending to happen is if you only use your quads, is you're creating all this force and tension purely through your knees, so particularly your patellar tendon, and the cruciate ligaments can take some strain as well, and it can also affect your hips and pull, much like your shoulder, can pull your leg bone out of its hip socket, so it's not subluxed, but it's not centered, and without centration, then you get hip problems and you lose your mobility. When you're going down the ski slope or when you're skiing, you want to be able to absorb force evenly. If you don't address this, what will happen is you'll load it more through the knees, more through the quads. Your ability to enjoy and get the most out of your ski sessions is compromised. Your injury risk goes up and your longevity to be able to enjoy the sport goes down, because every time you do it, you're basically taking a crapshoot. So do be mindful that even though we talk primarily about the shoulder and the upper body today, that it does have an effect on the lower body, and there's similar issues that we need to address with that. Basically, even when you were demonstrating the exercises, and it was fun, it was awesome, and I really appreciated the video, I could see the restrictions, the dysfunctions, and the patterns that actually could lead to a really significant series of injuries frustrations, setbacks, and handbrakes to developing your strength, furthering your athletic ability, allowing you to enjoy all this cool stuff that you're doing, and really, mess it all up. So I hope this was helpful to you. I hope it gave you enough in terms of helping you move forward. Loving the questions, loving that you're taking an interest in this stuff. It is important that we do that, because not only does it move you from a state of pain to a state of performance, but it allows you to develop that strength. Let me know how the shoulder's progressing. Let me know any follow-up questions that you have. Happy to support, and stay strong.